1 in 3 people over the age of 50 deals with this every single day. They buy special pads, they map out bathroom locations before leaving the house, they quietly cancel plans, stop exercising, and start shrinking their lives, all because of one symptom they are too embarrassed to mention, even to their own doctor. I am talking about urinary leakage, loss of bladder control, the sudden, urgent, sometimes unstoppable need to rush to a bathroom, or the leak that happens when you laugh, sneeze, or stand up too fast. Here's what nobody in a clinic is going to tell you clearly. This is not just an inconvenience. This is not just getting older. Your bladder is sending you a very specific distress signal about your hormones, your nervous system, your cardiovascular health, and in some cases, your kidneys. And most people are spending money on adult pads instead of reading the signal. If you want medical information explained without drama, without shame, and without anything left out, subscribe and tap like. Dr. Fulling's goal is 100,000 subscribers, and every single one of you moves that number. To understand why this happens after 50 specifically, you need to understand what is keeping your bladder continent in the first place, because it is not willpower and it is not just muscle tone. Your urinary system runs on a precise team effort. The bladder wall is made of a specialized muscle called the detrusor muscle. It stretches as the bladder fills and contracts when it is time to empty. Surrounding the urethra, the tube through which urine exits, is a ring of muscles called the urethral sphincter. These muscles must stay contracted, meaning firmly closed, except when you consciously choose to urinate. Coordinating all of this is a complex network of nerves running from the bladder to the spinal cord and up to the brain. There is a specific region in the brainstem, the pontine micturition center, that acts like a traffic controller for the entire system. It suppresses the urge to go when it is not appropriate and releases it when you are ready. Before age 50, all of these systems are working with a reasonable margin of error. After 50, several things converge at once. In women, estrogen levels drop sharply during and after menopause. Estrogen is not just a reproductive hormone. It is a maintenance hormone for the tissues of the entire pelvic floor, the muscles, connective tissue, and the lining of the urethra itself. When estrogen falls, those tissues thin out and lose elasticity. The urethral lining becomes less robust. The closure pressure drops. The margin between staying dry and leaking narrows significantly. In men, the prostate gland, a walnut-sized gland sitting directly below the bladder and surrounding the urethra, begins to enlarge after 40 in most men. By 60, more than half of men have measurable prostate enlargement, a condition called benign prostatic hyperplasia. As the prostate grows inward, it squeezes the urethra from the outside. This creates a partial obstruction. The bladder, working against that resistance every time it empties, becomes thickened and irritated over time. An irritated bladder is an overactive bladder. It fires urgency signals even when it is only half full. This is not aging. This is a biological cascade with identifiable causes. And identifiable causes have identifiable solutions. Here is what most people do not know. Urinary leakage after 50 is not just about the bladder. In a significant number of cases, it is a window into what else is happening in your body. I want to walk you through 5 of the most important signals this symptom can carry. Signal 1. Your blood sugar may be out of range. Diabetes and prediabetes are among the most underdiagnosed drivers of bladder problems after 50. Here's the connection. When blood sugar stays persistently elevated, excess glucose in the bloodstream begins to damage the small nerves that control organ function throughout the body. This nerve damage has a medical name, diabetic neuropathy, and it does not just affect the feet. It affects the bladder nerves directly. When the nerves controlling the detrusor muscle are damaged, the bladder loses its ability to sense how full it is accurately. It can begin contracting unpredictably and prematurely. This is called an overactive or neurogenic bladder. In some people, the opposite happens. The bladder loses the signal to contract at all, overfills, and then leaks because the pressure simply overflows the sphincter. Elevated blood sugar also forces the kidneys to produce more urine as they try to flush out the excess glucose. More urine production means the bladder fills faster. More filling means more frequent urgency and more opportunity to leak. If you have new or worsening bladder leakage after 50 and you have never checked your glycated hemoglobin, that is the 3-month average blood sugar test, that is the first conversation to have with your doctor. Signal 2. Your pelvic floor has been silently weakening for years. The pelvic floor is a group of muscles and connective tissue structures forming the base of your pelvis. Think of them as an internal hammock supporting the bladder, uterus in women, and rectum from below. These muscles are active in ways most people never think about. Every time you cough, sneeze, lift something, or laugh, they contract reflexively to prevent leakage. After 50, pelvic floor muscles are affected by the same sarcopenia, age-related muscle loss that affects the rest of the body. In women, pregnancy and childbirth decades earlier can leave behind structural damage that only becomes symptomatic once hormonal support is withdrawn. In men, any history of prostate surgery, even minor procedures, can affect the sphincter muscles and alter continence. The research here is actually encouraging. Unlike many things that deteriorate with age, the pelvic floor responds to targeted training. Pelvic floor muscle exercises, when done correctly and consistently, have shown in clinical trials to reduce leakage episodes by 50 to 70% within 12 weeks. The problem is, most people do not know how to do them correctly, and most clinicians do not take the time to teach them. Signal 3. Your heart may not be pumping as efficiently as it should. This connection surprises most people, but it is well documented. When the heart is not pumping optimally, early heart failure, or simply reduced cardiac output from years of unmanaged blood pressure, fluid begins to pool in the tissues of the legs and lower body during the day. This pooling has a name: dependent edema. When you lie down at night, gravity no longer holds that fluid in the legs. It is gradually reabsorbed into the bloodstream and processed by the kidneys. The kidneys then produce significantly more urine during the night. The medical term for waking up 2 or more times per night to urinate is nocturia, and while it has many causes, nocturia that worsened around the same time your ankle started swelling or you started feeling short of breath is a cardiovascular signal that should not be ignored. Signal 4. Your nervous system is showing early changes. The bladder is one of the most neurologically sensitive organs in the body. It requires continuous, precise input from the brain and spinal cord to stay controlled. This is why neurological conditions, Parkinson's disease, multiple sclerosis, early cervical spine compression, very often announce themselves first through bladder symptoms, sometimes years before any other signs appear. Sudden onset of urgency incontinence after 50, particularly if it comes with any changes in balance, coordination, or fine motor function in the hands, is worth raising with a neurologist. I am not saying this to alarm you. I am saying it because catching neurological conditions early changes the trajectory of treatment entirely. Signal 5. Your kidneys may be under silent stress. Chronic kidney disease in its early stages produces no obvious symptoms. What it does produce is changes in urine volume, frequency, and composition. As kidneys lose filtering efficiency, they struggle to concentrate urine properly. The result is a higher volume of more dilute urine being produced throughout the day and night. This creates increased frequency and urgency that people consistently mistake for a bladder problem when the origin is actually upstream. A simple blood test for creatinine and eGFR, estimated glomerular filtration rate, measures how efficiently your kidneys are filtering your blood. If you have been having bladder symptoms along with unexplained fatigue, swelling, or changes in urine color or odor, these are the tests to ask about. There are 4 evaluations that every person over 50 dealing with this symptom should know about and ask for. Not next year, at your next appointment. The first is a post-void residual ultrasound. This is a simple, non-invasive scan done immediately after you urinate. It measures how much urine remains in the bladder after you have finished emptying it. A healthy bladder empties to nearly 0. If significant urine remains, doctors typically consider more than 100 milliliters a concern. It tells you the bladder is not contracting properly, which points directly back to nerve or muscle dysfunction. This test takes 5 minutes and the information is invaluable. The second is glycated hemoglobin, HbA1c. We already covered why. This single test tells your doctor your average blood sugar over the past 3 months and will catch prediabetes before a standard fasting glucose test does. It is one blood draw and it belongs on the list for anyone over 50 with unexplained bladder changes. The third is a kidney function panel. Creatinine, urea, and eGFR together give a clear picture of how your kidneys are filtering. This is a routine blood test that is often overlooked unless specifically requested in the context of urinary symptoms. Ask for it by name. The fourth, specifically for men, is a PSA test combined with a digital rectal exam. PSA is prostate-specific antigen. Elevated PSA can indicate prostate enlargement, prostate inflammation, or in some cases, prostate cancer. Combined with an examination of the prostate size and texture, this gives a complete picture of whether the prostate is mechanically contributing to your bladder symptoms. Men are statistically less likely to report bladder symptoms to a doctor. If you're watching this and that describes you, this is your signal to make the appointment. Before I close, here are specific evidence-backed steps you can take starting today. First, track your symptoms for 3 days before your appointment. Write down how many times you urinate, how many times you leak, and what triggered each leak. Coughing, lifting, urgency, or nothing obvious. This information changes the quality of the conversation with your doctor entirely. It is not just more data. It tells a doctor what type of leakage you have, which determines what investigation and treatment is appropriate. Second, address fluid timing rather than fluid volume. The instinctive response to leakage is to drink less water. This is almost always the wrong response. Concentrated, insufficiently hydrated urine is a direct irritant to the bladder wall, which worsens urgency. What you should adjust is when you drink reducing fluids in the 2 to 3 hours before bed to manage nocturia, and spacing fluid intake evenly through the day. Third, eliminate or reduce bladder irritants. Caffeine and alcohol are the two most clinically significant bladder irritants. Caffeine has a direct stimulant effect on the detrusor muscle and also acts as a mild diuretic. If you drink 3 or 4 cups of coffee per day and have urgency incontinence, a 2-week trial of reduced caffeine is a diagnostic tool in itself. Carbonated drinks and artificial sweeteners are also documented irritants worth removing temporarily. Fourth, ask your doctor specifically about pelvic floor physiotherapy. Not a pamphlet with diagrams, a referral to a trained pelvic floor physiotherapist. This is one of the few interventions for stress and urgency incontinence that has strong clinical trial evidence behind it, and it has no side effects. Urinary leakage is not the price of getting older. It is not something to manage quietly with pads and avoidance. It is your body flagging real, treatable changes in your blood sugar, your nervous system, your cardiovascular health, and your hormonal balance. You now know what those signals mean and exactly which conversations to start with your doctor. Write down the 5 signals. Write down the 4 tests. Walk into that appointment informed, not embarrassed. If this video made a complicated topic easier to face, subscribe to Dr. Fooling and tap like. That is how we reach 100,000 subscribers, one person who finally got a straight answer at a time.